The topic of anal sexual practices is one that many shy away from discussing openly, yet it is a critical aspect of sexual health that deserves careful consideration and informed dialogue. This practice, engaged in by some heterosexual and homosexual couples alike, carries inherent risks that stem from the unique anatomical and physiological characteristics of the anal region. To fully grasp the potential dangers, it is essential to first understand the anatomy of the anus and rectum, how they differ from the vaginal region, and why these differences contribute to specific health risks. By exploring these factors in detail, we can better appreciate the complexities of anal sexual practices and the precautions necessary to protect sexual health. The anus serves as the terminal part of the gastrointestinal tract, while the rectum is the final portion of the epiphyme, large intestine. Together, they play a crucial role in the excretion of bodily waste, a function fundamentally different from that of the vagina. Unlike the vagina, which is designed to accommodate sexual intercourse and facilitate reproduction, the anus and rectum lack glands that produce natural lubrication. The vaginal wall is composed of robust, flexible tissue that can withstand the mechanical stresses of penetration and is supported by natural lubrication to reduce friction. In contrast, the rectal wall is a thin mucous membrane, highly vascularized and delicate, making it far more susceptible to trauma. This fragility significantly increases the likelihood of abrasions, lacerations, or lesions during anal intercourse, particularly due to the absence of natural lubrication and the mechanical challenges of penetration. These anatomical differences lay the groundwork for the heightened risks associated with anal sexual practices compared to vaginal sex. The vagina's design supports its role in sexual activity, with a resilient structure and lubrication that minimize damage during intercourse. It is anatomically suited to guide sperm toward the uterus for fertilization, a process aided by its natural elasticity and moisture. The anus, however, is not designed for such purposes, and the lack of lubrication often necessitates the use of external lubricants to reduce friction. Even with lubricants, the thin rectal mucosa remains prone to injury, which can lead to a cascade of health complications. These complications form the basis of the 5 primary dangers associated with anal sexual practices, which we will explore in depth. The first major risk is the increased likelihood of physical injuries to the tinseries to the pilinspeed. I'll explore in depth. The first major risk is the increased likelihood of physical injuries to the tinseries, anal and rectal tissues. As previously noted, the rectal wall's thinness and lack of natural lubrication make it particularly vulnerable to abrasions, lacerations, or lesions during intercourse. These injuries can cause immediate pain, bleeding, and discomfort, and they may require medical attention depending on their severity. The mechanical stress of penetration, especially if not performed with adequate care or lubrication, can exacerbate this fragility, leading to tears in the delicate mucous membrane. Such injuries not only cause discomfort, but also create pathways for infections, which brings us to the second significant danger: the elevated risk of sexually transmitted infections, STIs. The rectum's highly vascularized mucous membrane, combined with its susceptibility to trauma, creates an environment where STIs can be more easily transmitted compared to vaginal sex. The lymphoid tissue within the rectal mucosa, which plays a role in the body's immune defenses, is particularly rich in cells targeted by pathogens such as HIV. When abrasions or lacerations occur, these tissues become entry points for infections, significantly increasing the risk of transmission for diseases like HIV, syphilis, hepatitis B, hepatitis C, herpes, and human papillomavirus (HPV). Research has shown that the risk of HIV transmission during anal intercourse can be up to 18 times higher than during vaginal sex, a statistic driven by the combination of the rectum's vascularity and its propensity for injury. This heightened risk underscores the importance of using protective measures such as condoms and maintaining open communication with partners about STI testing and status. Beyond ST the third danger lies in the increased risk of bacterial infections stemming from the natural microbial environment of the anus and rectum. As part of the gastrointestinal tract, these regions are colonized by a diverse array of bacteria that form the intestinal flora. While these bacteria are harmless and even beneficial in their natural environment, they can cause significant harm when transferred to other parts of the body. For example, bacteria from the anus can be introduced to the vagina, urethra, penis, or oral cavity during sexual activity, leading to conditions such as balanitis, balanoposthitis, urethritis, or pelvic inflammatory disease in women. These infections can cause pain, discomfort, and serious complications if not treated promptly, emphasizing the need for hygiene practices and careful consideration of the sequence of sexual activities to prevent cross-contamination. The fourth risk, though less common, is the potential for anal incontinence resulting from repeated anal sexual intercourse. The anal sphincter, a muscular structure that acts as a valve to control the release of feces, is critical for maintaining fecal continence. Frequent or aggressive anal penetration can damage the muscles and nerves of the sphincter, leading to involuntary leakage of feces. This condition, known as fecal incontinence, can significantly impact quality of life, causing embarrassment and discomfort. While not all individuals who engage in anal sex will experience this complication, the risk increases with practices that place excessive strain on the sphincter, particularly if performed without adequate relaxation, lubrication, or preparation. This underscores the importance of proceeding with care and moderation to minimize long-term damage to the anal sphincter's function. The fifth and final danger is the onset or worsening of hemorrhoidal disease. Hemorrhoids are dilated veins in the anal or rectal region, and they can be exacerbated by the increased pressure and trauma associated with anal intercourse. For individuals with pre-existing hemorrhoids, the mechanical stress of penetration can worsen symptoms, leading to pain, bleeding, and discomfort. In some cases, repeated trauma may contribute to the development of hemorrhoids in individuals who were previously unaffected. The discomfort caused by hemorrhoids can range from mild irritation to severe pain, particularly if the condition progresses or becomes complicated by thrombosis or prolapse. Proper care, including the use of lubricants and gentle techniques, can help mitigate this risk, but it remains a significant concern for those engaging in anal sexual practices. These 5 dangers: injuries, STI transmission, bacterial infections, fecal incontinence, and hemorrhoidal disease highlight the importance of approaching anal sexual practices with caution and awareness. While these risks do not necessarily mean that anal sex should be avoided altogether, they do emphasize the need for informed decision-making and harm reduction strategies. Using high-quality lubricants, practicing safe sex with condoms, maintaining good hygiene, and ensuring mutual consent and communication are all critical steps in minimizing these risks. Additionally, individuals should be attentive to their bodies, seeking medical advice promptly if they experience pain, bleeding, or other symptoms following anal intercourse. Understanding these risks also empowers individuals to make choices that align with their health and well-being. For some, the potential dangers may outweigh the benefits of engaging in anal sex, while others may feel comfortable proceeding with appropriate precautions. Regardless of personal choices, education and open dialogue are key to ensuring that sexual practices are both safe and fulfilling. By shedding light on the anatomical and physiological factors that contribute to these risks, we can foster a more informed and respectful conversation about sexual health. For those who may be concerned about their sexual performance or overall vitality, it's worth noting that sexual health extends beyond specific practices to include broader aspects of physical and emotional well-being. If you've noticed a decline in potency, desire, or confidence, exploring natural